I'm Christelle from Diabetes Strong. In this video, I'll be talking more about Afrezza inhaled insulin. So I already made a video where I explained what Afrezza is. So in this video, I want to show you some examples of situations where I found Afrezza to be particularly useful. As you might remember from my other video on Afrezza, it's a dry powder mealtime insulin that you inhale, and it has ultra rapid absorption and an effect on blood sugars similar to the insulin response of people who do not live with diabetes. It's approved for adults living with type 1 diabetes or type 2 diabetes, but not for people with certain lung conditions such as COPD or asthma. For those living with type 1 diabetes or those living with type 2 diabetes who use multiple daily injections, you still need to inject your long-acting insulin, but you can use Afrezza as your only mealtime rapid-acting insulin. I've been using Afrezza for years, and for me, it's an integrated part of my diabetes management. I find it effective for quite a few different blood sugar-related situations that you might also recognize. I was compensated by MannKind to share my experience using Afrezza. My thoughts and opinions are my own. And remember, the situations I'm about to describe and how I use Afrezza are based on my personal experience. Individual results may vary. One of the situations where I find Afrezza to be particularly useful for me is when I decide to enjoy a spontaneous meal or when I'm eating out. You've probably also learned to pre-bolus when injecting mealtime insulin prior to a meal. We do that because injected mealtime insulin just takes some time to work and usually doesn't peak until an hour or more after injected. I prefer to not pre-bolus my injected mealtime insulin when out in a restaurant. First of all, I don't know how quickly the food will get to my table. I don't necessarily know the portion size, and I don't know if I like what I get. And there's nothing more annoying than having to drink juice or eat glucose tabs before dinner is served, or having to eat a meal that you don't enjoy just because the insulin has already been injected. What makes Afrezza unique is that it gets into the bloodstream in less than a minute. It starts lowering blood sugar levels in as little as 12 minutes. Because it's so fast, you can take Afrezza at the beginning of your meal, which in my opinion makes it the perfect option for eating out. So one thing is that Afrezza works fast, so don't need to pre-bolus. The other thing is that when eating out, carb counting can be really challenging. And the beauty of Afrezza is that I can always inhale a second dose if the initial dose wasn't enough to manage my blood sugars. So not only do I not have to worry about pre-bolusing, but having an option to add a second dose for those sticky highs after miscalculating my carbs is priceless. And you know what? Miscalculations can happen. Or maybe you forget to inject your mealtime insulin sometimes. Again, it can happen. What I appreciate is how effectively and how fast Afrezza works for me in order to lower high blood sugars. So let's just talk a little bit more about what exactly do I mean by effective. Do you ever find that your blood sugars just stay high? Those are what I call sticky highs. It's not a clinical term, it's just, I found that describes it really well. I know it's not just me who has those sticky highs, but what I find is that it can be really frustrating trying to correct a sticky high with an injected mealtime insulin. But I found Afrezza to be very effective for correcting a sticky high. And I wear a CGM, a continuous glucose monitor, and it's really fascinating to see blood sugars coming down from a sticky high after having inhaled Afrezza. So check this out. This is one specific situation where you can see how effectively Afrezza lowered the blood sugar for me. Remember, this is my experience. Results may vary. And another situation where I find Afrezza to be especially helpful is before exercise. So if you know me, you know I really enjoy exercise. I like both doing cardio as well as resistance training. But what I do not enjoy is seeing my blood sugars drop too low during exercise because of me having too much mealtime insulin in my body. Because remember, the only time we as people living with insulin-dependent diabetes see low blood sugars during exercise is if we haven't balanced our carbohydrate and our insulin levels. Cardiovascular exercise increases the risk of low blood sugars because as we move our body, we increase our insulin sensitivity. So for people who do not live with diabetes, their bodies will adjust their insulin levels when they exercise. However, for us who live with diabetes, we have to do that work ourselves. So the reason why I find Afrezza to be a great option before cardiovascular exercise is that relatively it doesn't linger in the body that long. If I'm eating and inhaling a dose of Afrezza for my meal 90 minutes to 2 hours before my workout, it should be out of my system by the time I start my workout. Again, depending on my dose, but thereby reducing my chances of going low. Absolutely brilliant. I do want to highlight that for me, it reduces the risk of low blood sugar. However, Afrezza is an insulin, and with all insulins, inhaled or injected, there's a risk of low blood sugar. Of course, those are not the only times that I use Afrezza, but these are 3 situations where I find it to be particularly useful. If you haven't tried Afrezza yet and think it might be something for you, here's how you go about getting your hands on it. You do need a prescription for Afrezza. You also need to get training on how to use the product and how much you should take, so a good first step is to talk to your doctor. Once you have a prescription, you have to get your Afrezza through a pharmacy. Naturally, over 70% of patients with commercial insurance have access to Afrezza, and many patients with Medicare insurance also have access to Afrezza depending on state and plan type. I pick up my Afrezza at my local pharmacy and I use the Afrezza copay card. So the copay card is a great option if you have commercial insurance and your copay is more than $15. And I'll leave a link to the copay card up here. If you use a copay card, you can pay as little as $15 for a prescription. But MannKind, the manufacturer of Afrezza, also have other options to help with the cost if you do not have insurance or if your insurance do not want to cover Afrezza. Just go to the website or call this number. Thank you so much for watching this video where I shared 3 situations where I find Afrezza to be particularly useful. So what do you think? Is this something you would try out? Leave me a comment down below. While you're there, if you like this video, please also give it a like. Thank you so much for watching. And stay tuned for important safety information.
Afrezza is a rapid-acting inhaled insulin used to control high blood sugar in adults with diabetes mellitus. Afrezza can cause serious side effects, including sudden lung problems and low potassium. Afrezza is not for patients with chronic lung disease such as asthma or COPD. Tell your doctor if you smoke, recently stopped smoking, have ever had kidney or liver problems, a history of lung cancer, or if you're pregnant or breastfeeding. Most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace long-acting insulin with Afrezza. Afrezza is not for use to treat diabetes ketoacidosis. Do not take Afrezza if you're allergic to insulin. Talk to your doctor before changing your Afrezza dose. Blood sugar may need to be checked more frequently.